The Disease Infectious Center at the Tema General Hospital is ready to handle any case of the deadly coronavirus. Well, that's according to the medical director of the facility, following JoyNews' checks on the preparedness there. The 12-bed facility has been on standby 42 medical professionals who have been given special training to handle any suspected case. Matilda Gavi of our health desk has been there. Here is her report.
And these facilities at Ridge, at Tema, for now are ready to handle any confirmed case within the country. And as much as possible, all the teaching hospitals, all the regional hospitals, and then other big hospitals in the country have the capacity to handle case. We've inspected such facilities, and some of them are in preparation, but then Tema and Ridge are ready, and then others are also beefing up their capacity. Risk communication, social mobilization, this is part of what we are doing. The lead of the risk communication has updated the national plan for risk communication, and this is being rolled out. Logistics and finance is very key. The initial budget for this is up to 35 million Ghana cedis using the above pillars. The Excellency has given 2.5 million cedis as a starter pack to start activities, fund the urgent activities that we are doing, and then subsequently, as we report and request for more, this will be added. We are also in touch with the partners to see how they will partner with the government of Ghana to provide more support if need be, either technical, cash, or kind. Coordination, you mentioned all these things, the National Technical Coordination Committee, regions and districts. I think all these are being done importantly, and alerts being sent. We've met the various key partners and stakeholders. The Minister of Health, I'm aware, has met the key stakeholders together with the Director General, the various CEOs of the teaching hospitals, the regional directors, and then the private providers, their leadership, Dr. Morrison, the CHAG. So all those people whose activity are very relevant for this, the management of this outbreak, have been engaged. And then the engagement is ongoing. We continue to dialogue and discuss with them to step up all that we would observe and the subsequent things that we need to do. The private sector, National Ambulance Service, Noguchi, KCCR, and all these groups have been met. The Kutuka International Airport, Tema, and other seaport, other points of entry leadership. As we speak now, there's training and orientation going on for all the port health staff here in Accra, and it's up to tomorrow. And so this capacity, we will not say that the capacity is optimal for now. We are doing best. At the moment, whatever you do and where you need to step up, we move and step up appropriately. I'm aware the Honorable Minister of Health has engaged the ambassador for China to Ghana, and a lot of discussions, important discussions has been done. One, to agree and discuss with modalities to map out the various Chinese communities within the country and see how we interact with them, minimize and restrict movement to the country from China solely to essential trips, and then also vice versa. So movement for now to and from the affected area should be informed by the essence of what is being done. We've planned a number of stakeholders engagement. You've mentioned them. Beyond the regular national structures that you've met, meeting with World Health Organization, CDC, UNICEF, and other development partners. All these are very important, and you've done this. The national objectives for prevention and containment is very key. Just to sum up and saying that the leadership of this ministry, Ghana Health Service, and then the health sector are doing best to reduce importation of this virus into the country.
I must sincerely apologize for that. That was actually Director General of the Health Service, Ghana Health Service, Dr. Bedusa Kodie, instead of Matilda Gavi's report from the Tema General Hospital, which we will bring you shortly. But we know that today the Ministry of Health also issued a statement, and in that statement, the Minister, Kwekwa Agyeman Manu, explains that All the experts they've engaged have advised against a mass evacuation of Ghanaian students in Wuhan. And this is important because that has been the call for the students who are in Wuhan there. But these are excerpts of the statement. It says that we once again wish to reassure Ghanaians, especially parents and relatives, and Ghanaians in particular, Ghanaians in Wuhan city and the entire Hubei province, that our citizens are in good hands and are being taken care of. The Ghana Embassy in China is in constant engagement with them and has been constantly updating us of events. The statement goes on to say that we are working in collaboration with the World Health Organization, West African Health Organization, U.S. Centers for Disease Control, and other development partners, discussing and reviewing our strategies day by day. So far, all advice through consultations and engagement is not encouraging us to undertake mass evacuation as yet because of the following, and it lists those. It says, number one, sub-regional consultation. The West African Health Organization is engaging member states and has not recommended evacuation yet. Number two, the public health principles in outbreak situations. Are all these notwithstanding, the Ministry of Health says we are reviewing the situation by the hour, and when it becomes necessary, we will lower the next line. We will tow the next line of action as appropriate, including evacuation. The government of Ghana is much concerned about our citizens in China, especially the Ghanaian students, and is working to ensure their protection, safety, and well-being as we continue to supply their basic needs. It goes on to say that we want to assure the public that as per the engagement of all outbreaks, which is a dynamic activity, we will continue to monitor the situation and act as appropriate. The advice or further wish to advise Ghanaians to delay non-essential travels to China. So what's that technical advice the ministry is referring to here? Director General of the Ghana Health Service, Dr. Bafo Ewa, explains.
I mean, in all such outbreaks, what you do is to prevent spread. And as long as there are systems in place that has been able to keep people from getting infected for the last few months, one can say that these are adequate systems, especially if you look at the high transmission rates of that virus. And that's why we feel that so far no student has been reported to have contracted the virus, despite the fact that they are in the epicenter, which means that whatever systems are in place seem to be working. And that's why we continue monitoring to see if the risk increases, then we will advise otherwise. But on as technical people, we will not think that we will need to do that. And probably the movement will not even be maybe more hazardous than the situation that they are in now. So that's our advice.
And to the parents of these students who are stuck there, what do you tell them?
I believe that the information we have is that Ambassador is in touch with them. Our minister has spoken to a couple of students, and there are health workers whose children are there. So we are in touch with them, and we don't think that the situation is such crucial that the risk profile is higher. But we believe that as the condition peaks and declines, the risk will even probably come lower, and so there's no need to look at that.
The students themselves are saying this morning that they are in in locked up areas. They cannot go out to get food, water, and other things. Does this call for this evacuation? Because they seem not to agree with your decision to keep them there.
Those are protocols that we need to verify with the ambassador and probably to see what is it that it's a lockdown, and the lockdown is that you're not going out. There are even in families where only one person is allowed to go out at the same time, and so these are all systems put in place to prevent you from people gathering and transmitting the condition. And that's why we kept saying that we'll look at what are the support system that they are having within that condition. But under such conditions, the same way we quarantine them when they come here. So I'm sure it's the same situation that they are in. If they come for the next 14 days, they are still going to be in similar conditions. So what we need to know is that, are they getting water? Are they being fed? Are they getting the social service that they need? And I'm sure the Ghana embassy is very concerned and ensuring that all those things are being done.
Let's bring you that story about the Infectious Disease Center at the Tema General Hospital being ready to handle cases of the deadly coronavirus, according to the medical director of the facility there. Matilda Gavi's report. The Infectious Disease Center here at the Tema General Hospital is one of the few facilities that have been designated by the Ministry of Health should we record a deadly coronavirus case. Felix Mensah is in charge of this facility, and he has been taking us through the process.
If there is a suspected case or a confirmed case, then this is where is our waiting area. This is where you will come and rest here before you go in. Yes, this is in charge's office. This is where the in charge will be when they coordinating some of the activities. Come along, we have our washroom here. When you come here, you can go to the washroom, do everything here before you go in there. But when you go in there, you are not coming. You have to make sure you do everything in there. Then you pass the other side out.
Oh, okay.
Yeah, so you are not coming back unless maybe you are out. You are coming back in for something. That's why you come and pass through here again and go in.
Okay.
You are now going in here.
Okay.
So you go in. So this is the main ward.
Okay.
This is what we keep. If a suspected case or confirmed case, this is what we keep the cases. We try to, if you have one, we try to give them the bed as close to the door as possible. So that they will not come into the So this is the beds that we have there. Now we don't have any case in Ghana now, so the places that is true. When you are done with that, come and pass before. Okay.
Dr. Richard Anthony is the medical director for the Tema General Hospital. He has also been telling us how prepared the facility is should a case be recorded in the country.
Yes, we have PPEs, that's the personal protective equipment. There is a dedicated team which is made up of a mix of health staff, ranging from nurses, doctors, pharmacists, administrators, even orderlies, which are part of this emergency response team, which has been put in place in readiness for this coronavirus, or we don't know what will come up even tomorrow. So it's an ongoing process. And in terms of logistics, we've been promised that should there be need to increase the number of PPEs that we have, central government and Ghana Health Service is ready to do that.
Okay. In terms of the professionals, do we have a figure already, or do you mind sharing with us the number of professionals that have been designated?
In fact, when there is a case of that nature, because it's a shift, and one cannot stay in there for a very long time, at least you need not less than 3 shifts. And looking at one shift alone, for a day, going through the 3 shifts, we need not less than 42 different categories of staff, which we have. So the staff for the management of these cases already been sensitized, and we have the list ready should there be a case. Usually patients that come first report to the outpatient. Outpatient, from what we have put in place and discussed, such person will quickly be isolated. In fact, we have a screening process. Those with cough and other symptoms similar to, which may not necessarily be coronavirus are screened and separated. But should we have a strong suspected case, the patient will be moved straight from the outpatient to the facility which has been earmarked for isolation or quarantine. But being quarantined does not mean you have the disease, but you are going to be handled as if you have the disease till it is confirmed. But at the OPD, you are not going to be wearing the whole full PPE. Sample will be taken, and sample will be sent to Noguchi for confirmation. Then, before the patient, if it's confirmed, the patient will still be there anyway at the same site, since we don't have any patient at the moment. So suspected case will be kept at the new same place till it is confirmed. But if we do have confirmed and non-confirmed cases, then they will not be mixed, because if you are suspected, you cannot be put at the same place as somebody who has been confirmed to have the disease till you are confirmed.
Matilda Gavi of our health desk put that report together from the Tema General Hospital. So let's have a bigger conversation about this situation. In the studio with me is Dr. Ja Julius. He's a former NUCS China president who is also current president of Global Union of Ghanaian Students. Dr. Ja, you're welcome to the show. I also have here in the studio Kwesi Mensah. He's a former president of the Ghanaian Student and Korea and Associates, a Ghanaian student in Korea and Associates, member of GUK's trustee board. Joining us via Skype will be Lord McMensa, chairman of Ghanaian Student in UK. Lord, you're welcome. Also president of Global Union of Ghanaian Scholars. I also have Eric Bequin, who is secretary for NUCS China. Mr. Bequin, you're also welcome to the show. I'd like for you to join in the conversation. Send us your thoughts. What do you think about evacuating or a mass evacuation of Ghanaian students in the Hubei province in China? The number is 0540-109-009. That's 0540-109-009. Let's start the conversation right now. So I'd like to start with those of you who are on Skype, because you are not here at the moment. Lord Mark Mensah, who is president of Ghanaian Students in the UK, also president of GUKS. What's your own position? You are not at the epicenter, you know, like Mr. Eric Bequin, who is in China. What's your own thoughts about mass evacuation of Ghanaian students in Wuhan or Hubei province as we speak?
First of all, I want to thank you for the opportunity to be here and actually express our opinion and our feeling towards the government and exactly what's happening with our members in China. I have been to China. I was in China last year, so I know what China looks like. What is happening right now, our worry is that our members were not told at the beginning the government plan. So the government kind of has deceived our people, gave them false hope, telling them that they will be evacuated. Until last night, we were told that there was a meeting with the ambassador, and it was confirmed now that the government will not be evacuating our students from China. Now, let's paint a picture here for you to have a look at what's happening. You are in a situation where even the citizens, the Chinese government, they're painting different picture to the world. Those in the midst of, the epicenter are complaining that it's scary. Now, as a young student with no family, no relative, and that kind of terrain, and then you see citizens suffering, and you foreigner, you are in that situation, hoping that those who are supposed to care for you, to protect your welfare and well-being, are now telling you that you're on your own. I don't think anything the Ghanaian government said to our members, they will believe it now. because they have lied to us for so long.
Because of what has happened previously. You're saying that what government did was to give false hopes to the people in China by I believe you're saying they promised that they will be evacuated.
Yes, that's what they told them at the last night.
Okay, let me bring in China. Let me bring in China. He is in China, Mr. Eric Bequin, who is in China. Mr. Bequin, thanks for your time as well. Did you get false hopes in your engagement with government representatives in China as far as evacuation was concerned? Okay, I see you talking, Mr. Bequin, but unfortunately I cannot hear you. I think we need to sort this out, the sound bit out, and try and get back to you. But I'm coming back to studio. Dr. Julius, who is the Vice President of Global Union of Ghanaian Scholars. I'd like for you to answer that question for me whilst we try to get Mr. Bequin back on the line. Were you giving false hopes?
Thank you very much. Yes, I think when this whole issue started, we've been in contact with the president and the leadership of Ghanaian students in China, and they did inform us that through the embassy that they've been made aware they would be evacuated. And so all along the line, the students in the epicenter, Wuhan, were hoping that anytime soon they would be evacuated.
That makes me a little bit curious, because the calls we were getting from Ghanaian students in Wuhan was a call for evacuation. They were calling to be evacuated. So why would you put in those calls when you have already been given the hope by government that you will be evacuated anyway?
Okay, so like the president in UK said, there's been constant communication from what we've been told. And then the president in China has made us aware. There have been several meetings. First of all, I want to thank the officials of the embassy, Honorable His Excellency Edward Boatin, Ambassador, and his team. They've been doing well, and for several times they did assure them that they are in communication with the team in Accra, Foreign Affairs, Health, and the presidency to see how best to be able to evacuate them from the hard-hit center. And so for the past about 2 weeks, the students have been praying. I think all the students have been doing with the call is to try to express how urgent situations are and why we need to act as soon as possible.
Okay, let me bring you in as well, Mr. Kwesi-Mensah. You've been in China. You studied in China?
South Korea.
Oh, South Korea.
Yes.
But you traveled to China?
I've not been there yet.
You've not been there yet. You know South Korea also. I don't know if it's South Korea or North Korea, but the disease has spread to Korea.
Yes,
we know that for sure. And so I'm sure that you have an idea how quickly this disease, can spread.
That's right.
Government has said today that they cannot do a mass evacuation now. This should suffice for students who are calling for evacuation, don't you think?
Well, first of all, thank you very much for the opportunity. What I'm thinking about now is the fact that if government is not ready to undergo an evacuation process now, then when will be the right time? Because day in, day out, all we are getting is the fact that the disease is spreading at a faster rate.
Yeah.
So if you are unable to evacuate at a point where it's, gradually gaining ground, then when will be the appropriate time for you to do that?
Okay.
And so what we are considering is the fact that we have students who are on the ground at the epicenter.
Yeah.
Those students are crying. They are crying for nothing but for help.
Okay. You talk about help. We have the ministry speak, but I'd like to refer you back to a part of the statement, and if we can pull the statement up, you have a question, and that question is, if government is not ready to do the evacuation now, when? It says in the statement that they're reviewing the protocols hour by hour, and I want to just see if I can just point you directly to it. It says that government is, we're working in collaboration with the World Health Organization, West Africa Health Organization, U.S. Centers for Disease Control, and other development partners, discussing and reviewing our strategies day by day. He says so far, all advice through consultations and engagement is not encouraging us to undertake mass evacuation. So they say it is something that's ongoing. You don't seem to have confidence enough as far as this is concerned.
I do have confidence in the government of Ghana and then in the other global organizations. But the reports and results that we've had until now have not shown that the disease is decreasing, but we're having an increasing rate. People are dying day in, day out. I think we have been on the fortunate side that we've not had any casualty from Ghana, to be specifically the Ghanaian students.
Okay.
And so what we are looking at is the fact that we have confidence in the government of Ghana.
Okay.
However, our students who are on the ground, they are crying.
Okay.
Just imagine.
I just to interrupt you briefly, yes. And I can do it rather than do the imagination. Dr. Ja, you studied in China, right?
Yes.
Did you study in Wuhan as well?
I studied in Haikou. That was in Wuhan last year.
Okay.
That was when we had our 62nd independence anniversary celebration.
All right. So I just want to bring it back to, he was trying to help us to imagine it. You have been there. Yeah. So give us a mental picture. I mean, we're looking at, I want you to compare the health system in Wuhan or in China, because you studied there, with what you see here in Ghana.
Okay. Yeah, first of all, it's right to say that the health system in Wuhan and China, for that matter, is far better.
Far better. If you say far better, would you say 100% better, 50% better, 25% better? Can you give us an idea?
Probably a 50% better.
50% better.
Yes.
Okay.
And so at this point, it's true that if we have cases, probably the Chinese government can take care of them. But this is the case where our students are stranded. If you go into the details, the students are stranded. For about 3 weeks, we've been told they've not been allowed to move out at all. They wake up, you sit on your chair, you go back to bed. They are not even allowed to move onto the corridors of their rooms.
Okay.
So those students are indoors, no activity at all. The food issue, you get diverse reports from different schools based on how...
And I want us to tackle the food issue separately. Because we're hearing government is telling us that they are indeed taking care of the Ghanaian students there, but the Ghanaian students are also reporting back to us that they are not. Some are painting a very gloomy picture. So I'd like for us to tackle that one. But let's see if we can get connect to Mr. Bequin in China. Mr. Bequin, let me see if I can bring you into this discussion at this point. Some people have said, and I've heard some parents of Ghanaian students in China say, that it's possible to even move them from Hubei province or from Wuhan to another part of China. Mr. Bequin, I'm told that we lost you briefly, so let me bring back the question. The question is, since you are in China, I've heard some parents call for removal of Ghanaians in Wuhan to a different part of China. If you agree with this, do tell us, and tell us which other parts will be safer, in your opinion.
All right, thank you. My regards to seniors who are Honorable Lord on the internet. I want to agree with my seniors actually that government, one way or the other, in our negotiation, and also the other with the parents, that the situations that coming in recently that is necessitates the award in Wuhan and Hubei to be great. Now let me clarify this. The reason why one way my senior colleagues were, we entered into what the national executive.
I'm having a real challenge with our connection there with you, Mr. Bequin. It's not smooth. Maybe we should try again. But as we try again, I'd like to move this discussion back to you, to the UK. Let me quickly cross-check Lord McMensa in the UK. What are your own thoughts about moving? Because I think that we all admit at this point that you cannot necessarily put Ghana's health system and China's health system on the same scale. There will be an imbalance. And so that is clear. China has a better health system than Ghana has. The WHO indeed has said that Ghana is one of the countries with weak health systems, and that puts us at risk. I want to find out from you what your thoughts are about the suggestion to perhaps move them from Wuhan to another part of China, also considering that there are concerns about mass movement of people within this area that has been affected. Lord.
Yeah. Yes, of course. There are plus and minuses in everything in this kind of situation. When we talk about mass movement, I don't know, because I personally feel our students back in China are being kind of used as, the picture being painted here is like they are coming to Ghana, bringing this disease to create problem for the government and people around there. But the question I am asking is this: if you find yourself in a situation where everyone around you is dying, we're talking about at a rate of 1,000 deaths so far being recorded or reported. When is the government going to move them? We have to wait until someone contacts the disease, because the disease is spreading so fast. So if we wait until they start contacting the disease before we bring them to Ghana or lift them to somewhere, most of our students in China are self-funded. Okay, that's number one. Most of them need to do some kind of part-time job to feed themselves. And now all of a sudden, those people cannot go out. Our students cannot do anything. And we are even hearing that some of them are threatening suicide action. Okay? So my problem and concern for my members is this: in this kind of situation, they are going to, or we are putting them through very deep mental trauma. The torture these students are being subjected to, it will be very difficult to heal. The emotional wounds are very difficult, and psychological wounds are very difficult to heal as a counselor. And this is what I'm saying, that it is better for us to prepare your mental status now. Tell them that you're not able to evacuate them, but we are trusting the Chinese government to look after them, because we believe that our system back in China cannot be compared to what, even if you contact the disease, in China.
So I take it that that's your suggestion, that's your recommendation or suggestion as far as what we ought to do is concerned, that government should engage the students more. I'll take your final word, but I'll do a final round because we've actually run out of time. I want to really give China another try. We really ought to hear from China on this case. Mr. Bekwin, if you can hear me again, let's take it from where do we go from here? From your perspective, what can we do? This is a very complicated situation. I mean, first of all, I can so relate to the situation that Ghanaians the students in Wuhan are going through right now. First of all, studying outside your home country, outside your comfort zone is not easy without an outbreak like this. So I can really understand. But we're also looking at a situation where we don't want to put an entire nation at risk, which is what the experts are telling the health ministry. From your perspective, what can we do really moving forward?
Okay, all right, thank you very much. I hope you can hear me clearly.
Yes, go ahead, please.
All right, yeah, thank you. First of all, let me send my thanks to my senior colleagues who are already in the studio. I agree with their statements. We have one way of the gap in terms of our for them. When the cost of evacuation case, on NEC, National Executive of China, had to either to, speak media, concern our stance on the media on people who evacuate, or enter into the position, always take updates in terms of numbers and the welfare of our members through the Ghana embassy. And so we entered into our what as closed door meeting, because we used to give up concerning any progress we make in negotiation to our members, and the day-to-day meetings that we've had 6 meetings so far from January 31 or the 31st of January till now. We've had 6 meetings, and these meetings were different for the entire members who are at the street. We are looking at about
the sound is not helping. I'm really constrained with time. The quality of the sound is not helping. But what I hear you say is that there have been several meetings, 6 meetings, you say, with the Ghanaian authorities in China. You say throughout all of these things, you've been giving them updates. I believe the point you're driving at is that they have not been perhaps as open with you as they ought to be. I think we will try and engage you again in the coming days on this particular thing. But my final words for all of you is that we've heard about food and about provision. We've heard from the ministry, from governments, that they've actually been providing for you, and that the reports we're getting are not as accurate as far as Ghanaian students saying that they are constrained, there is no food, there is no water, etc. Why are we not getting, I mean, who's not telling us the truth here?
All right, thank you. I think, like I said, the embassy have tried to solve the problem. Even recently, money has been sent. And from what I've monitored today, I was told each student is supposed to receive $500 in Wuhan. Now, the challenge goes beyond just receiving money. The food stuff are even not there. Those that are there, the prices are very expensive. Some shops are still on the lockdown. Let's not forget that we just finished the Chinese New Year. And so transportation itself is still not open up yet. So those students, although they will even get the money, they might not get the food to buy.
The last time I had one of your colleagues here, he told me that there's about two Ghanaians, I think, who usually go out on motorbikes. You know, they dress up and then go out to look for food, and then they come and share. Is that system? How is that system working? Do you know of it?
It depends on the various schools. For the students who are living on campus, they are not even allowed to go out at all. When you are living outside, maybe in your own apartment, then you are allowed, probably when you are safely dressed, to go out.
Is the government not providing, the Chinese government not providing food for people across the country, including Ghanaians who are there?
They are providing. Some schools provide. We are told some schools provide and some do not. However, the challenge again is the food. You know, this is the Chinese food, which some people still do not eat. Some of the students probably came to China in September or October to start the academic semester and probably are even not used to the food. So those are the concerns that they've been raising. Pictures of the food have been brought onto the national pages. And so we've come to accept. That's why we are saying that they should try everything possible to evacuate the students.
Okay. And you are for the idea that they can be moved, they can be moved to somewhere else in China, not necessarily to come to Ghana?
Evacuating into China is, as of now, by the laws made by the Chinese government, it's not possible. If they're evacuating, they should evacuate them to Ghana. And my concern is just 9th of February, about 3 days ago, Singapore evacuated their citizens. The evacuation has been taking place since about 24th with Vietnam. So this is about 3 weeks. What is stopping us from evacuating our members? Okay. Probably we do not have enough medical resources like Singapore and all those other countries. But we're saying that if there should be a foreigner arriving today with the coronavirus, let's imagine from the airport or the flight that is coming with everyone coming to Ghana, the airport, the transport system, the family, the hospital. We could get a case where we have over 200 members or 200 citizens that we have to quarantine them. So what are we going to do in this case? Because the students in Wuhan are also just about 200. So we should, as a country, be able to bring these students down and have them.
All right. Let me bring you in for your final words as well. What do you make of the Ministry of Health saying that they'll put people to quarantine who come from Hubei province at least 14 days? What it means is that if the Ghanaian student in Wuhan want to travel individually, they can do so that it is not a sort of mass evacuation. I know Lord doesn't really like the word mass, but for lack of a better word.
Sure. From my own perspective, I think it's a good step in the right direction. That alone will take some of the stress that the students are currently undergoing over there in the epicenter of the whole issue. Now, the issue of evacuation, when they come to Ghana, it doesn't mean that they are just going to be allowed to move around for the 14 days.
Yes, the Ministry of Health says they will be quarantined for 14 days.
Yes.
If that's not for students, it's for anybody who's traveling into Ghana from the Hubei province.
Yes,
I'm saying that will you advise? Is this an advice you throw to your colleagues in China or in Wuhan, that if they can afford to make the move themselves individually, that they should make?
Yes, I would encourage them to do that. But we're talking about students who are self-funded, like some of their studies, they had to actually work to make money to, you know, pay for their own living expenses and tuition fee and others. And throughout the outbreak of this disease, I'm not quite sure what amount of money they might have on them. And so if the government is saying that now you have the liberty to be able to undertake this exercise, I'm not quite sure how many people will be able to do that.
So it boils down to government evacuating them.
Yeah, to add,
I've actually run out of time. I need you to make that very brief for me if you want to make any intervention.
So the Global Union of Ghanaian Scholars, that's the mother body for all students in the various countries, about 30,000 of us. We are embarking on a fundraiser to support our students. It's not just in China, just that we are focusing. There are students in Korea, in Japan, and other countries. And so we come with a GoFundMe account and also a Barclays Bank account, which we'll be bringing out tomorrow. Tomorrow is Valentine's Day, and so we are pleading on the whole public to join to support the students. You need this medical equipment. The prices have shot up. Even in Ghana, the face mask, a box that contains 25 was about 10 cedis. But just this past month, it's rise to about 1,500 cedis.
So you're raising funds to help.
Exactly.
This help is to provide food for them or to help them?
The medical equipment and all that will make their life comfortable. We'll also wait for the evacuation process.
Okay, God bless you for that intervention, and hopefully we'll be able to come to a conclusion about this matter. This is a very dicey, it's a real dilemma we're in here as a country, but hopefully we'll find a way out. But if you're in China and you're looking to travel to Ghana, remember that you'll be quarantined for 14 days when you get to the airport. And Ghanaian students there are still demanding an evacuation. Thank you very much for coming. I've been doing this conversation with Dr. Ja Julius, his Vice President, Global Union of Ghanaian Scholars, former President of NUCS China, and Kwesi Mensah, who's former President, Ghanaian student in Korea, and associate. I also had on Skype Lord Mensah, President of Ghanaian students in the UK, and Eric Bequin, Secretary NUCS China. This is still the